Thank you, Mr. Chairman. My name is Julia Bels. I'm a medical student from Maastricht, and I'm happy to present our study on the long-term follow-up of intravesical Botox injections in male patients with idiopathic overactive bladder. We were interested to see whether there was any influence of prior prosthetic surgery. Affiliations. Botox injections are a safe second-line treatment options for patients suffering from idiopathic overactive bladder. Even though proven effective, clinical practice still shows high dropout rates, which is reflected in multiple studies. This demonstrates the difficulty of good patient selection. Data on Botox treatment in patients after prior prosthetic surgery is limited. Habashi et al. Studied clinical improvement in continence in patients with and without prior prosthetic surgery and only found significant improvement in the radical prostatectomy subgroup. We conducted a retrospective study of 120 men with collectively 207 Botox injections between the period of 2004 and 2018, and we had a median follow-up period of 23 months. Baseline characteristics only differed in age, percentage of wet OAB, and percentage of prior history of continence surgery. Rates of clean intermittent self-catheterization did not differ for the three groups. In the results, we see that the discontinuation rates are similar for the three groups, but there is a significant difference in de novo need for CIC, which is highest in the group without prior prostate surgery. This effect was not explained by differences in dosage or prior use of catheter. Although only 29% of patients were still on active treatment at last point of follow-up, over a third of patients reported improvement of clinical symptoms. And next, we saw similar discontinuation rates across the three groups, but a significant difference in de novo CIC, which translated into odds ratios of 3.3 and 8.4 for the group without prior prosthetic surgery compared to the TERP and RP subgroup respectively. In conclusion, discontinuation rates remain high at about 70% and are similar for all three subgroups. And de novo CIC, clean intermittent self-catheterization rates are lower in the group after prior prostate surgery compared to surgery-naive patients. Thank you for your attention.
Thank you very much. Are there any comments or questions? You stated that you start CIC when there is a post-volume residual of 150 milliliters. Mm-hmm. Is that really necessary? I mean, if the patient hasn't any problem, is it necessary to start at such a low level?
Yeah, thank you for your question. That's indeed the advice from our department, but mostly they rely on clinical symptoms and clinical indication for CIC. So it was not always that they had to start CIC starting from a PVR of 150 milliliters or more.
Any other question from the floor? Thank you very much for this nice presentation. Congratulations.